First of all, let me introduce myself. I think I know virtually everyone in this room, but for those that I haven't had a chance to meet, my name is John Leary. I'm the CEO of Health Perspectives, and our service offering is called Medicare for Employers, as you can see in the screen behind me if I move to the side. But let me go ahead and get started to talk about what we're intending to spend some time with, which is leveraging Medicare to the benefit of employees and employers. And if my clicker works appropriately, why are we focusing on that? Well, it's something that we call the healthcare squeeze. And this is something that afflicts all employers across the country. And it's maintaining that delicate balance between, on the one hand, surging medical costs, and that was something that I think all of you are probably aware of. Even if you're not an employer, you're well aware of that. And it's gotten even worse within the past couple of years. So we'll talk more about that in a second. And then also balancing, addressing healthcare needs of the employees. And those are sometimes conflicting priorities. It's difficult enough to do one or the other, but when you're trying to do both, as the head of HR or as the CFO of a company, it's a real challenge. And so what we're here to talk about is a new approach to addressing that challenge, and we call that Medicare for Employers. That's me turning 65. And when that happened, I was still in corporate America. I was working for a good-sized company. And when I turned 65, I knew a little bit about Medicare. I should know a lot more about Medicare at that time because I had been in healthcare for about 30 years. I had been a hospital administrator, I had run home healthcare operations, I'd been on the insurance side, the technology side. So I actually thought I knew more than I actually did. And because of that, I made two bad mistakes when I turned 65. Mistake number one was I assumed, because my employer was paying roughly 75% of my premium, that my group plan was definitely going to be less expensive than Medicare. I was wrong. The second assumption that I made was, well, this is a progressive company, they're doing great things, they're actually involved in healthcare. I'm sure that the federal government can't do better than my company can in terms of the coverage that would be offered. I was wrong again. And so this was really the genesis for me to move from viewing the group health plan as nirvana, the end all, to realizing that no, in many cases, older employees would be much better off on Medicare. What you're looking at is the number of people over the age of 65 in the United States over the past 100 years. So starting in 1920 and moving ahead to 2020, you can see the growth. And there are two things that are remarkable about this. Just how steady those increases were for most of that time. So between 1920 and 2010, it looks like it's roughly the same percentage increase of people over the age of 65. Obviously, that changed in 2020. Why did that change? Anyone? The baby boomers, exactly right. It was the baby boomers. So in 2020, the baby boom generation, roughly half of it was now 65 or older. So that's the big boom. Half of the baby boomers were now over 65. Obviously, the other half are going to be there in 2030, because it's about a 20-year time frame from the beginning of the baby boom generation to the end. And so in 2030, you're going to see another big jump. We've talked already about the number of people over the age of 65 in the country. What's going on in the workforce? Well, this is going to help us answer that question. So I'm going to put all of these numbers up here, and you'll see at the bottom, these are numbers that are coming from the Department of Labor. And so at the beginning of this century, in 2003, not a lot. About 3.2% of the workers were over the age of 65. But you'll notice it starts to creep up to 5.2% in 2013, went up to 6.7% in 2023. But as you can see, the projection for 2030 is it start to move back up again. Part of it is because of the baby boomers, part of it because people feel safe about going back to work. And so now it's almost triple what it was in 2003. So why are these people working longer hours or working longer years? The have to is one of the big reasons is because of the change in Social Security full retirement level. It used to be 65, you walked off the shop floor, you had Medicare and you had full retirement Social Security. That changed. Social Security was running out of money. Congress decided to push out the year that you would get full retirement. It went out 1 year, and then a few years ago, it went out 2 years. So now, if you want to retire and you want full retirement income, it's not 65. It's now 67 you have to wait till in order to be able to do that. Fewer people are on defined benefit plans. That was, in the heyday in the 50s and 60s, there were a lot of companies that were offering that. Some unions still do, some larger companies still do, but the drop in defined benefit plans has been ongoing for the last 50 years. So there's not a lot of people doing that. So if I can't count on what I'm going to get in my future years, then maybe I'm more uncertain about whether or not I should retire. People are living longer. This year, 2025, if you turn 65 and you're a woman, you have 20 more years on average. If you're a man, you have 17 more years. So when people become aware of that, they're thinking, that's a long time. That's almost a quarter of my life is going to be spent over 65. And so I don't know if I have enough money to last that long. To either further emphasize that point, this last number comes from, I think, AARP. 20% of the people over the age of 50 have zero retirement dollars. They have nothing waiting for them. Those people are going to be working for a while. On the other side are people that want to work over the age of 65. They want to work because they're healthier. They can keep going. They can keep working. So they want to do that for as long as they can. More jobs are less taxing. So because of automation and technology, it used to be when my grandfather was working in a mill in New England, you're using your body to move those threads around, those rugs around that they were making in those mills. Well, now that's all automated. You don't have to worry about that. So if automation is taking over for the human body, it means people can work longer. I don't know if I want to be a roofer and be on a roof, particularly on a day like today. Can you imagine being on a roof if you were 65? But there are many people that are bankers. They are working in higher education. There's a lot of jobs out there that doesn't require using your body. They like the positive reinforcement. If you've been working for 30, 40 years and now you're 65, you probably know a thing or two. And it's great that people appreciate the fact that you do have that knowledge that comes with experience. So they get that positive reinforcement. Hey, you're a valuable part of the team. Socialization versus loneliness. One of the key problems that older people have in this country is they're lonely. Their spouse may have passed away. Their kids may, live 3 time zones away. And that's a problem. Well, where are most of their friends? At work. So they're going to keep working because that's where their friends are. And then finally, a sense of purpose. A reason to get up in the morning, believing that you're contributing still to that society that you're in, that community that you're in. So those are all reasons why people are doing it. And then the quote at the bottom, you can see, this is pretty amazing. More than a third of the people are expecting to retire after 70 or not retire at all. So there's a lot of people that are thinking that their time horizon in the work world is long. So this was an interesting slide, and you may not be aware of it. All of the different companies at the top, they all work with employers. They're employee benefits consultants. Some of them may be actuarial. Some of them it's an employers association like the Business Group on Health. So they're working with employers all the time, and all of them do an annual survey. What do you expect in terms of premium or pricing increases for your company based upon your conversations with your consultant, what's going on in the marketplace, and so forth? You'll notice that post-ACA, but before 2024, you'll see that it was typical to have a 6% increase. In 2024, that cost trend made a jump up about 7.25%. It's no longer 6, it's now 7.25. In 2025, it's going up even more, closing in on 8%. So that's a dramatic shift upward for employers to be able to bear that burden. And then I added a couple of additional numbers that just came out recently. Matter of fact, the number from the Business Group on Health came out on Tuesday of this week. So they're looking ahead to 2026 now. They're planning for 2026. It's not that far away. And they're saying either 8.5% or 9% increase. That's a huge burden on employers. So let's take a look, do a deeper dive on what does it look within the workforce. What does it look like between the folks that are between 19 and 64 and the folks that are over 65? The 65 plus folks, their health expenditures per year are close to $22,000. I was talking to a university this morning, and they were talking about their 65 plus population, and it's not unusual for them to see claims that are over $100,000. Now, stop loss is going to help them probably with some of that, but that may make their stop loss rates go up because of that experience as well. But this population is much more expensive, especially when you compare it to the 19 to 64 range. So a big difference when you cross over into the 65. My two artificial knees are testimony to that. That's almost 2.5 times as much for those over 65 as compared to the younger population. So with all of that data that we just talked about, if by 2030, 9.5% of the workforce is over 65, and if their costs are almost 2.5 times as much as the younger population, that means that in 2030, the population of over 65 could consume as much as 20% of your healthcare budget. That's a big nut. And something needs to be done about that, and we have some thoughts about how you can address it. The last point there was that 20%, when it comes to that 65 and over population, what's unique about them is they have another alternative. Someone else could be funding their healthcare costs. It doesn't have to be the employer, and that's what we're going to talk about today. So let's talk a little bit about what members think about Medicare, that alternative, that other choice that people over 65 can do. They really like Medicare. And we can see that through this survey that was done by the Kaiser Family Foundation in 2023. They surveyed 3,600 individuals that had a wide variety of different types of insurance: Medicaid, Medicare, group plan, the VA. And they asked them a series of questions, but I'm going to focus in on kind of the summary question, which was, how do you grade the overall performance of your insurance? And here's what they said in comparing Medicare to employer-sponsored insurance. They liked it a lot. 91% rated it either good or excellent. Now, Medicare has an unfair advantage. When you compare it to the employer-sponsored insurance, that employer that's sponsoring that insurance, they need to be all things to all people. Because they're not just thinking about their employees or even the spouses, they're thinking about the fact that they're having babies too. So the age range that an employer needs to think about goes from a newborn to people older than I am. And that's a real challenge to try to meet the needs of all of those people in a wide variety of different spans of life. Medicare doesn't have that issue. Medicare was built for and continues to be for people over the age of 65. Medicare is not worried about maternity care and NICU days and pediatric care. They're not worried about that. They're worried about helping older people stay healthy when their body is starting to decline. That's what they're focused on. Very proactive, very preventive. Some of the folks that are here today from Centerwell and Archwell, they only provide services to people on Medicare because it's specialized care. And so when people start to think about Medicare, they'll think about what kind of Medicare, but an equally important point is that they need to think about how is that care going to be delivered? Who's the provider? Who's the clinician that's going to be doing that? And that's a very important point.
Yeah, so John, I mean, a couple of things to go back. You know, the study that the Business Group on Health did, and identifying what they think their trend will be in 26. There's a couple of points I want to make about that before I get into your question. The first is that if you look at that study, they identified a few key conditions, if you will, that are driving that. GLP-1s, surprise, surprise, is definitely leading the way in terms of total impact.
For those that don't know GLP-1s, that's Ozempic and
Yeah, absolutely,
like that,
absolutely. I'm sure all of you in this room have probably heard of these and a lot, right? And there's some amazing things about those drugs, for sure. But trying to get a hold of that spend is a very big challenge for all of us, employers for sure. The other factors that they noted were increase in the prevalence of cancer. We've seen that uptick, I think, over the last 3 years. It's continued to go up. And mental health utilization, a lot of that is coming from a younger population, which is scary in and of itself. But on the other hand, positive in some ways that people are getting the treatment that they need. But to John's point earlier, this is also impacting 65 plus, because as John made the point, the issues that older people deal with when it comes to loneliness, when it comes to sense of purpose, they feed right into that. But the other thing that they had on their list was a growing proportion of older employees. So the Business Group on Health would say they think that is definitely contributing. The other thing I would say is that if you look at the statistics, and you talked about this from CMS, Centers of Medicare and Medicaid Services, they estimate that 35% of all the medical spend in the United States is coming from folks over 65, yet they make up 17% of the population. If you drill that down to the USI book of business, and we do some really deep data analysis on what's driving claim spend, what we see is that for folks that are over 65, their medical spend and their pharmacy spend is almost double the members we see that are ages 40 to 64. And if you look at chronic conditions, in the top three on both of those groups is high blood pressure and diabetes. The over 65 population is almost double from an occurrence perspective from that age group of 40 to 64. So it's a big problem for sure. And obviously that is going to impact your spend as an employer if you have employees that are over 65 on your plan. So I think you have to address it for sure. And it is definitely impacting that training number. The other thing I would say too, John, that's important is, hospitalizations is one of the things that has been identified as being on the uptick for driving cost. We know that the health systems have done a really good job figuring out how to use AI to maximize coding. So legitimate coding within the terms of the contracts they've got with the carriers, but they're maximizing what the reimbursement is on those services. And unfortunately, the carriers have not done as good a job using AI to figure out how to combat that. So most of the large carriers expect the numbers in 26 to be way higher than 9%. I don't think the Business Group on Health would have caught that because it's a recent thing that's just started happening. But my guess is that when you get to the end of 26, unless the carriers can figure this out, that number is going to be double digits.
Great. And we're going to talk about that. We call that the path forward. So step number one, what we would recommend to an employer is just quantify what the issue is. So do some census information digging. How many employees are over 65? Where do they live? That's an important attribute. Also, their dependents. Many of the folks that we talk to fail to remember, I've got 100 employees that are over 65. Okay, how many dependents do you have? They forget about that. So you need to add that. And then in looking towards the future, you need to see how many people are the age 62 to 64. Because those people are going to start thinking about, do I retire or not when I'm 65? Do I stick around? So you need to know what's coming down the pike in terms of that 65 plus population. So once you've done that, once you have a better feel for, okay, I can put my arms around, here's the population, so here's what I'm grappling with now and into the future. If it looks like there's a substantial population, then it's worthwhile to go to the next level. And the next level is to quantify the financial impact. And so what I'm going to show to you is an example. This is a prospect that we're working with right now. And you can see we've got a 5-year time horizon here. It's a company with 2,000 employees, but we also need to think about those dependents as I just talked about. The third column is the national average. What portion of their population is over 65? In 2026, that's almost 8%. It'll be 9.5% by 2030. So it's a growing problem, as we talked about before. There's the number of employees, just doing the multiplication. We're seeing that about 31% of employees that are over 65 have a spouse that's over 65 as well. So we need to add about a third of that to give the total. And then we need to estimate, so how many of these folks will make that change? And we talked about the education that needs to happen, and we're going to talk about that again in the future. But we're assuming that because these folks are still working, if you have the early adopters that move to Medicare while they're still working, they're going to start saying good things about Medicare to their buddies at work, to their colleagues. And so we expect that if it's going to start about a 20% switch from group plan to Medicare, that's going to bump up to 25, 30, 35 as the years go by and they're hearing great things about Medicare. Then from that point, it's really doing the math. It's taking a look at how many people switch, what's the cost per life, and that's something we would get from the claims information from the employer, and that gives you the cost savings per year. And so a population of 2,000 employees, in this case, you're looking at potentially saving $6.3 million because people made a decision that they thought was best for them. Now that they had the information about Medicare, they're thinking, yeah, Medicare is going to be much better for me, so they're happy, and the company obviously is happy because now you're talking about significant savings. So once you take a look at that and say, yeah, this is something I really need to exert some effort on, step 2 is really developing a game plan that is unique to that particular company. It's taking into account, what is the employee profile? What kind of people do we have working here? What's the culture of the company? What do we have right now in terms of benefits for people? What's the group plan look like, et cetera? And so there's 2 pieces, the corporate Medicare plan that will be developed. And then once people are comfortable and they want to learn more about Medicare, then it involves individual Medicare advisory services, one-on-one, talking with people about their personal needs, what's unique about them as a person. So this is an overview of both of those, the game plan for employers and the advisory services for employees. And so it's doing an analysis, again, what makes it unique, writing a game plan, developing the resources. And these are going to be used continuously, an ongoing communication program, a toolkit that they can use to input their own personal information to decide how does Medicare stand up to the group plan, giving them that side-by-side comparison. Here's what you have now, here's traditional Medicare, here's Medicare Advantage, so that they can make a good decision. Once they have that, and they put up their hand, that's when we get them involved one-on-one, and you have that personal analysis, the comparison with the group plan, and then ongoing support. And this is where that transition that I was talking about before, Shannon. So if they're working with, while they're still an employee, if they're working with a licensed Medicare advisor, when they do decide to retire and they move on, that doesn't mean they lose that relationship. That continues on into the future as well. Step number 3 is the implementation. Once the game plan is developed, then there's a year-round communication. It doesn't happen overnight. When people have fixated in their mind, hey, a group plan is better, Medicare's not for me, that's for when I retire, it takes a while to get them to change that perspective. So it's a year-round campaign, and there's a lot of different messaging that we can help them make that adjustment in a perspective that says, maybe I should look into this. Maybe I don't know as much about Medicare as I should. So the communication is going to be customized, again, for the uniqueness of that population, that employer. It's going to be continuous. It's going to be comprehensive, not only about Medicare, but how it stacks up compared to the group plan.